All right, today we're going to be talking about wheelchairs and how they relate to patients with MS. So the objective of this video is to understand the indications and considerations for progressing MS patients to different types of wheelchairs. So let's get started. Here we have listed the multiple types of wheelchairs. We're just going to run through all of these and show the indications of when a patient needs to move on to the next wheelchair and kind of different features of each chair. All right, so the first wheelchair is the manual self-propelled wheelchair that most people are familiar with. This is typically indicated for patients that have unsteady gait or at risk of falls, as well as if they have increased fatigue, but they still have the upper body strength to be able to propel themselves around and perform their activities in this type of chair. So here's the typical wheelchair that all of us are familiar with. The next chair is an electric scooter. This is a 3 or 4 wheel chair. It has a basic seat and back cushion. This is indicated when a patient might not have the upper body strength to move themselves around, but they still have adequate core posture and strength, as well as upper extremity mobility to move themselves around in this chair. Patients in this stage typically still have the ability to reposition themselves and transfer independently in and out of the chair. And so here on the left, you can see the standard chair, your basic, and then on the right is more of a deluxe version of this power scooter. After that, patients typically move on to a power wheelchair. It can be driven from the front, middle, or back wheels. With this, patients typically have an inability to maintain an upright posture, so they need a little bit more external support from the chair. And so with this chair, it has that external support as well as a forearm support and a joystick so that they can maneuver themselves around that way. With these chairs, one thing to be cautious of is some of the power systems in the chair sometimes need to be upgraded every once in a while due to typical wear and tear. And here's a picture of that chair. With the next chair, a power chair with seating functions, these typically have customized seating options for patients that are going to be more wheelchair bound. These patients typically have decreased head and trunk control, and they have a limited ability to reposition themselves, so they're going to be stuck in the chair for long periods of time. And so it's good to be aware of skin breakdown as well as joint or muscle contractures, since they're going to be in these chairs for long periods of time throughout the day. And these chairs typically have an ability to elevate the legs up and down as well as recline the backs so that they can decrease lower extremity edema as well as the possibility of muscle contractures. Here you see a picture of this chair. And lastly, we have specialty positioning chairs. The features on these are similar to the other chairs. They have a lot of external support, but they're not power operated due to the patient's lack of vision or judgment to operate the chair. And so they're typically operated by an external person like a caretaker or family member. With these, patients typically don't have the ability to reposition themselves independently. They often need help. And so these chairs often offer the ability to tilt or recline to relieve the pressure as they're typically wheelchair bound for the entire period of the day. So it decreases the risk of pressure ulcers, joint or muscle contractures, and it helps manage the lower extremity edema. And so here's a picture of those chairs. And so one thing to be aware of in clinic when looking at wheelchairs and assessing MS patients is one thing that you want to do is assess their upper extremity and lower extremity strength, just to make sure the wheelchair they're in is appropriate for them and that they can be as active as possible to decrease the muscle degeneration and atrophy that they're facing. You want to observe their postural control to make sure they can maintain an upright posture, and if not, give them suggestions as to what wheelchair would be beneficial to them. And you want to assess their skin integrity every time they come into clinic to make sure they're avoiding pressure ulcers and other skin complications like that. And you also want to educate your patients on the proper way to transfer in and out of a chair, or a family member that may be assisting them the proper way to do that so the patient stays away from other injury. And one of the most important things is to make sure as much as you can to keep the patient moving, get them up and ambulating as much as possible to slow the progression of their disease. All right, so here's the question for the day. Who thinks they know the answer? Yes, Katie, press your mic.
So I think Professor Stewart, I think the answer is A.
Darn, shut up.
Well, I think it's B.
Well, actually, Dar, Katie is right. The answer is B, an electric scooter.